So Moderna says that there is a deal in place. Can you confirm that a deal has actually been reached with our government?
That's my understanding, Peter, and Minister Hunt will be making a more detailed announcement later in the morning, but it's more good news in the context of vaccine supply for Australia.
OK, well, is there anything more you can add to that? What more do you know about it? I can appreciate the fact that Greg Hunt will talk about this later on, but what more can you say about the deal?
Look, I've only had the opportunity this morning to have a very quick conversation with Greg. He has the specific details of that, but in the context of additional vaccine capacity, which has been one of the factors that's impacted on the rollout of the vaccine strategy across the country, it's good news that we will have when this vaccine becomes available, bearing in mind it still needs to be approved by the TGA for utilisation here in Australia. But it's good news for supply of vaccine in our vaccine rollout. Have
you got a rough time frame?
My understanding is that some of the doses will become available later this year. So that again is good news, but of course it still does have to go through the TGA approval process to ensure that, and we can provide confidence to Australians that all of the vaccines that we're supplying in the rollout here in Australia are safe.
And primarily, who would receive them?
Well, that decision again will be made and recommended to the government by our health authorities, as we've done all the way through the vaccine rollout. But as you see, under current circumstance, the current mRNA vaccine that we have here in Australia, the Pfizer vaccine, is being given to those under 50. But as we have more supplies, it may be that we can extend the capacity to other age groups, but those decisions haven't been made yet.
OK. Is this another example, though, of a deal that the government should have sorted a long time ago?
Well, we've been in negotiations with vaccine suppliers and discussions with vaccine suppliers for a considerable period of time. We've obviously got this particular arrangement to a point where we're able to announce a deal, but the various negotiations have been at different stages all the way through, and we'll continue to talk to the sector as the vaccines evolve. And of course, as the capacity for them to deal with variants evolves as well. So the vaccine strategy will continue to be an ongoing thing for a considerable period of time yet, I think. There's already discussions around the options and the requirements for additional vaccines and booster vaccines subsequent to the initial process. So we'll still be evolving and engaging with the sector in the context of how the rollout continues for a period of time yet, and we'll continue to do what we've done all the way through, which is to take the advice of our health specialists, and that's served us very, very well.
Are you expecting the Moderna vaccines to be manufactured locally as well?
We're discussing the options that we have with respect to the manufacture of mRNA vaccines here in Australia on a number of fronts. And as we continue those negotiations, obviously we'll get to a situation where we're able to make specific announcements. But we are, I think, in a good position because we do have sovereign vaccine capacity here in Australia now. And obviously, given the fact that there will be an ongoing requirement for vaccines, and mRNA vaccines are probably one of the future vaccine types that will be available, it would be good to have that capacity here in Australia.
OK, just still with Moderna, one final one here. Is it going to be for those under 50, or will aged care residents be able to get them as well?
Well, aged care residents are pretty much already vaccinated. The vaccination for aged care residents will be completed in the next couple of weeks for first dose, and their second doses have been set aside as a part of the process that we already have using the Pfizer vaccine. So we won't be switching vaccines for aged care residents. We'll continue with the current vaccination type and system that we have, and the first doses of those will be completed in the next couple of weeks, and of course the second dose following 3 weeks behind for completion.
OK, so just to confirm, so by the end of, next month, all aged care residents should have received 2 jabs?
All of those who want to take it up pretty much should have received it by that point in time, but the advice that I had talking to the department yesterday was that in the next couple of weeks we will have finalised the vaccinations for residents in aged care.
OK, and what about workers?
Well, that work continues, and obviously the advice that we received from our health authorities with respect to AstraZeneca meant that we had to have a reset of the vaccination rollout for aged care workforce. We're working extremely well with the states, so there are a number of outlets and opportunities for aged care and disability workforce to get vaccinated, whether that be in-reach programs into residential aged care facilities, whether it be state hubs through their GPs. There are a number of opportunities so that we can, as quickly as possible, get the aged care workforce vaccinated on the back of the work that we've been doing for residents.
What percentage of the workforce would you say at the moment has been vaccinated?
Look, I think the total number of vaccinations in the workforce is somewhere around 50,000, 56,000 was the latest figure that I saw.
And what does that equal in terms of
And of course that
percentage?
has... the total workforce is about 366,000 that we're accounting for as a part of the process. So there is some more work to do in respect of that. But of course, the rollout was disrupted by the health advice that we received to restrict the rollout or the availability of the AstraZeneca vaccine to people 50 and over.
Okay, just onto your budget. The budget spent in aged care received well for the most part. A couple of points on this though. What good is it, the big spend, if wages for aged care workers remain low? Because how are you going to attract staff?
Well, you're right that the workforce in aged care, whether that be in residential aged care or home care, is vitally important, and we've made a significant investment in this budget in training for workers both in residential aged care and workforce. There is currently a case before Fair Work Australia, which is the appropriate place for it to be, and the Royal Commission confirmed that. And we look forward to that process continuing. And that will be a very important factor in the overall growth and improvement in the quality of service provided. But we also have provided some additional assistance, particularly for nursing staff who are the drivers of quality of care in residential aged care. So we're supporting in this budget some additional resources and some additional funding directly to nurses to support them in the aged care sector and to attract them to the aged care sector, including some specifics around training.
And what sort of guarantees are there as well to guard against malnourishment? Because there's nothing that can stop the provider from keeping that extra $10 fee per person, right?
Well, as a part of the reforms that we're putting in place, there'll be much more financial transparency. There'll be reporting that's required publicly. There'll be a new star rating system that will provide consumers with information directly relating to the performance of providers. And that'll go not only to quality standards, which will incorporate things like the quality of food, but also the clinical care that's being received. And so what we're talking about here is not just about a big pot of money. It's a significant investment by the Australian taxpayer in the system, but we're talking about a fundamental reform of the way that aged care is delivered in this country. There'll be a new set of quality standards. There'll be additional capacity and resources for the Quality and Safety Commission. There'll be additional oversight. So this is a fundamental generational reform of the way that aged care is delivered in this country. It's not just about the resources. They are very important and they will support the reform of the sector, but it's a significant job to do, and it will take some time. We've set ourselves a 5-year program to implement these reforms. Some of them are quite complicated. There'll be a new Aged Care Act. So this is a fundamental generational reform of the aged care sector.